Prepare to experience the strongest radio allowable by law. Secrets will be revealed. Myths dispelled. From the studio gym where excuses never apply, it's Superhuman Radio with your host, Carl Lenore.
Welcome back. If you're looking at the title of today's show and going, oh, I don't have sleep apnea, I'm not going to worry about this. Stop for a minute. Do you snore? Truthfully, do you snore? I don't mean like a little passing sound here and there in your throat. I mean, do you snore? Do you sleep with a partner? Do they complain that your snoring is so loud it interrupts their sleep or they can't fall asleep? Or does your family laugh because even though your bedroom's on the second floor, they can hear you snoring downstairs? Snoring is not natural. It's not. It may be one of the earliest signs that you need to take a look at what's going on, because just the snoring part alone appears to do some things to the body that we really don't want. But when it turns into obstructive sleep apnea, when you're having all of these pauses in breathing throughout the night, and you are aroused, as they call it, over and over again, hour after hour, it not only damages your brain, but it appears to damage the heart as well. We're going to talk about a study that looked at the use of CPAP. And again, I want you to listen to this show if you snore, not like this isn't me, I'm not there. I want you to just humor me and say, the snoring alone is not good for me, and I'm probably heading down this road. Maybe I better pay attention. Really. Before we get started, of course, I have to thank our title sponsor, and that's Legendary Foods. They have the greatest snacks in the world if you're somebody who doesn't want a ton of sugar. The tasty pastry cake style is unbelievable. They can't keep them in stock. Less than 1 gram of sugar, 20 grams of high-quality protein, and, of course, 5 grams of net carbs if you're a net carb person. You can go to shrnetwork.biz/legendary to learn more about them, or use the code SHR10 once you're there to make a purchase if they're in stock. I'm warning you now. I'm getting emails from people saying, oh, they can't keep them in stock. You know why? They're that good. You can snack and you'll feel like you're cheating, but you're really not. And yesterday, I failed to put a secret word in the commercial breaks. I'm so sorry. So it's there today. If you listen for the secret word during the commercial break and you email it to onair@superhumanradio.net along with your mailing address, we'll send you a free box. It doesn't get any better than that. Now I'll bring my guest on without further delay. Okay, here we go. Oh, that's the wrong image. Look at that. Where did that come from? That was from yesterday's show. Dr. Diego Mazzotti. Mazzotti. How are you, Dr. Mazzotti?
I'm doing good, Carl. How are you doing?
Good, good. So let's talk about, before we talk about this study, let's talk about what we thought we knew and what we know now about obstructive sleep apnea. At one time, it was thought that, oh, people with big fat necks, they have this problem. But now relatively lean people and people who are otherwise considered healthy seem to have obstructive sleep apnea as well. What's going on here?
Yeah, I think that's a very good question. And I think that even though we understand that the major risk factors for sleep apnea are still like male, sex, and age, and high body mass index, or weight, and all the factors associated with it, like the large neck circumference, we know that that's not really a disease that affects these groups of people. I think there is a lot of evidence now that the disease is so heterogeneous, or the disease is so different in different groups of people, that if we just try to stereotype patients with sleep apnea from those characteristics, we are going to be missing a lot of people that are going to be needing therapy, right?
Right.
And I believe that there is now some studies looking at different craniofacial restrictions, or different shapes of the face and the mandible, that can explain a little bit when you are, for example, off this high-risk groups, why you still have sleep apnea. So there's some of the recent studies doing that as well.
So Dr. George Touliatos is a good friend of mine. He is a physician in Greece. And he points to the things that I want to say are now no longer universally true, right? He says losing weight, snoring begins, snoring is benign form of breathing. It's not benign. It's not. And I'm going to prove that to you in a second, George. Leading to hypoxia that kicks off the EPO, kidneys, blood thickening. And then he goes on to say, generally people with increased BMI have narrow pharynx, and that makes air form turbulence. But the reality is we have people that are so lean and they have obstructive sleep apnea. We have children, young children who have to undergo surgery to widen their jaw because it's closing. So obstructive sleep apnea is a phenomenon today, and I don't think any of us are looking in the right place. And that's why we have, well, it's this, no, it's not. Well, it's this, no, it's not. It's really a moving target at this point in time. And I want to point out one other thing real quick. Snoring is not natural. If I restricted your breathing while you were working at your desk, you'd get mad at me. You'd be like, look at the people. I can't wear this mask. The pandemic, I can't wear the mask. I'm going to get lightheaded. Now you're sleeping and you're supposed to be resting, but you're literally gasping for air 10 times a minute. Now, children who snore have a higher rate of ADHD and problems in school, and the ones that got their snoring fixed, it went away. So snoring is not natural. It's not benign. It's not part of the human condition. It is actually an aberration. And if you snore, you need to pay attention to it now, right now. What do you think? Too strong? Am I being too strong?
Well, I think it's a very good argument. I do believe that if you snore, if you snore loudly, if other people observe that you snore and you feel tired in the morning, you definitely should be checked out for obstructive sleep apnea. And obstructive sleep apnea is a very, very prevalent disease. And we know that if you count based on studies that look at the prevalence of the disorder across the world, we estimate that there's 1 billion people, 1/7 of the population of the world has obstructive sleep apnea in its mild, moderate, severe form. If you only look at the moderate, severe cases, the number cuts down, but it's still 500 million people that are affected by this disorder. We need to do something about it because only a very small fraction of these folks are being treated.
Okay, now besides CPAP, which we're going to talk about in depth because of your study, there seems to be some other approaches to dealing. Acetazolamide, which is a water pill, typically it's a diuretic. I think they've used that, but that's not used with people with frank obstructive sleep apnea. That's with people who are having transitional obstructive sleep apnea. What is that? Well, if you've lived in a high altitude and then you come down, or vice versa, there's a transitional period where you develop obstructive sleep apnea because of the carbon dioxide oxygen imbalances in your blood. Can you talk about the role of carbon dioxide in the phenomenon of obstructive sleep apnea, please?
Yes, absolutely. So what happens when you have a breathing pause? You pretty much your blood and does not distribute oxygen for a very short period of time. So during that time, when you have the respiratory pause, you're not getting the oxygen that you need to get, and that gets into some centers in your brain that identifies whether this is normal or not. Like, do I get enough oxygen? Do I have an excessive of carbon dioxide in my tissues? So if so, I need to do something about it. And then what the brain does is send signals for the body to wake up, right? And that's when as you wake up, you have like a stronger muscle tone for your airway, which then reflects in a stronger patency of your airway, which helps then sustain it open at the expense of you actually getting awake or getting an arousal for it. So that's really the communication between the blood gases and the brain is what dictates whether you're going to wake up. And one of the things, as we try to understand how a difficult to characterize disease it is, right? It's beyond just those conventional risk factors, is that some people, they might be very good about responding to this arousal threshold, which means that, if you're good enough to respond to it, maybe you are not going to have the consequences of that you see with the events, like, for example, the decrease in the oxygen, in your blood oxygen, or you might not see as much of that type of effect affecting your cells, like the oxidative stress and the inflammation. So maybe if you're faster responding it, you might wake up more, but on the other hand, you might also have the consequences of sleep deprivation because you're going to be waking up more. So that makes obstructive sleep apnea a very complex disease to understand. And the way that we currently characterize the disease, which usually you go get a sleep study, a sleep test, a polysomnography. They hook you up with several wires overnight. You have like a home sleep apnea test that can be done as well. But those tests are summarized with like one number, which is called the apnea hypopnea index, right? Which counts how many times we stop breathing per hour of sleep. And each count actually represents a 10-second pause. So if someone has like an AHI of 30 or an apnea hypopnea index of 30, that means that they stop breathing for at least 10 seconds, 30 times in
1 hour. That's insane.
Yeah.
That's insane.
However, we know that the disease is not bad. So, for example, what happens if the respiratory pauses take 9 seconds? We're not counting that. Or what happens if they take 30 seconds? We're not taking that into consideration because we're only counting how many times they happen. So now in the research in the area, we are trying to develop better biomarkers for sleep apnea. So can we use the data that we currently have from the sleep studies to have a better number or better numbers, which I believe that's what's correct, to better characterize the disease and better inform whether someone is going to develop a cardiovascular event or a cognition event and so on. So the research is now trying to better characterize the disease. So
I would also argue that if you're young, and by young, I mean under 50, because I'm 63 now, I'm still young. But I would say that if you're young and you're still in the reproductive age group, the body has the ability to compensate for a lot. If you are still able to create offspring, the body fixes as much as it can. It holds everything together. But once you get to that point where you're beyond the reproductive years, the body goes, you are not serving any purpose here any longer. You can't continue the trajectory of the species. It's time for you to go away. And that's when those people who snore violently day in and day out, but get up in the morning and say, well, I have a cup of coffee and I'm fine. I'm okay. That's when you literally hit the wall. And when you hit that wall, it starts out waking up in the morning feeling like somebody hit you in the head with a hammer. You're tired. Your heart rate starts to change. You may have episodes of tachycardia, completely unexplained, sitting at your desk. Your heart starts to race. A protein called D-dimer will go up in the blood. Inflammatory markers will go up in the blood. The blood will start becoming thicker and thicker and thicker. So that's why I say, I'm going to say it again. If you snore now, if you're one of those people who snores, you need to address it now before it becomes obstructive sleep apnea, in my humble opinion. But with that being said, talk about your study. How was your study designed?
Yeah, so absolutely. So we have like this long-lasting question in the field to whether using CPAP or treating sleep apnea with CPAP can prevent cardiovascular disease, right? And this question is intriguing in a sense because we have a lot of evidence of all those physiological changes that we see during sleep apnea. They all contribute to risk increase for cardiovascular disease. So, for example, when we have those respiratory events, our oxygen saturation goes down. That creates an oxidative stress response, inflammatory responses, and all those molecular changes. We know in studies looking at the cells and the tissues that they cause damage to cardiovascular tissues, which will then increase the risk of having cardiovascular disease. So then, it's easy to propose a study to say, well, if we treat sleep apnea with CPAP, which is currently the most efficacious therapy that we have out there, can we prevent cardiovascular risk, right? And that's really a challenging question to respond, and I'll explain why. So the way that in science we try to determine the cause of a therapy or a treatment, we have to do a study that's a randomized control trial or a randomized control study, right? We get patients, they are at risk for cardiovascular disease, and then we split them randomly in two groups, and then we give the therapy for one group and do not give the therapy for another group. And then we follow them long term, and then after several years, we try to measure whether the group that received the therapy, they decrease their cardiovascular risk they had less cardiovascular events compared to the one that did not have a therapy, right? Now, why this is challenging in patients with sleep apnea and looking at cardiovascular disease? Because we have enough evidence today from past studies, which I also participated, that there is only one subgroup of patients that could be characterized by increased excessive sleepiness that is at increased risk for cardiovascular diseases. So we did this study using a population from the Sleep Heart Health study, which is a community-based cohort of patients in the United States, that we have a group of patients with sleep apnea that report excessive sleepiness. So patients that they wake up, they are tired, they sit on watching TV, they fall asleep. They are all the time feeling tired during the day, right? So what happens is that when we have this group of people, we believe that sleepiness is one of those biomarkers that might classify patients with sleep apnea as having high risk for cardiovascular disease. Now, going back to the trials, right? Do you think that would be ethical to randomize patients that we know that they are sleepy? We know that CPAP will improve their sleepiness and decrease their risk of having car crashes. But is it ethical to randomize this group of patients to having no therapy?
Right.
That's not, right? So we can't really do a study like this. So we need to start thinking about other alternatives of how we can answer that question. Does CPAP prevent cardiovascular disease by other methods? And that's this recent study is about. Instead of prospectively assigning patients to therapy according, randomizing them in groups and assigning them to therapies prospectively, we will look back data from the past, from several years in the past, of patients that eventually use their CPAP more and compared to patients that eventually use their CPAP less, right? So that's their natural decision or their natural choice about selecting and using CPAP. So we are not randomizing them. On the other hand, we have like a limitation of this type of study because it is observational, and we don't know whether the fact that they use more or less could be influenced by other factors that we are not measuring. So even though we see there is a signal and an association between the use of CPAP and the risk of cardiovascular disease, we still only have an observational evidence, which is like a level below than what the trial could give us.
Right.
But if we can do the trial, maybe that is something
The
that
next best thing.
still can be important for us, right? So our study, we looked at a clinical population of patients that were part of the Kaiser Permanente, Southern California.
How many people? How many subjects were included?
So we had enrolled in the study, we had over 45, almost 46,000 patients.
That's
they
good.
were eligible to participate. So remember, we're looking at data back, right? Retrospective data. So these patients in the span of 2 years, those are all the patients that we're seeing. There's Sleep Clinic, and that's a collaborator, actually a couple of collaborators from Kaiser Permanente that we are working together. So Dr. Dennis Huang and Dr. Jiao Shaoxi. So those collaborators, we're part of a larger study looking at the effect of PAP adherence on several other outcomes. And as part of this larger study, we looked retrospectively at this data of almost 46,000 patients. And we had a group of patients that did not have sleep apnea, so they had a sleep study, and they were not diagnosed with sleep apnea. So those are what we call
controls. Those are your controls, yeah.
Then we have a group of patients, which was about 34,000 patients that they were diagnosed with sleep apnea. And among those groups, we had a group that did not use CPAP, or they either didn't accept CPAP as a therapy, or they use less than 4 hours of use on average over the course of the study, right? Again, the study could take about, on average, it took 280 days. So we looked at data for about like 3/4 of a year from those patients retrospectively. And then we have another group, which are the good users, people that use their CPAP greater than 4 hours on average across the study period. So now we have all those groups. And what we see is that when we compare patients that have sleep apnea and they were not using CPAP, they are at increased risk for cardiovascular events. And then the cardiovascular events that we actually look at is just a combination, is a composite score of the first occurrence of myocardial infarction, stroke, unstable angina, heart failure, or if they die from a cardiovascular cause. So these events were grouped into this large, category of like major adverse cardiovascular events. And the people that were diagnosed with sleep apnea that did not use their CPAP, they were at increased risk for cardiovascular events. And if they used their CPAP, they were not, right? So we see here that CPAP is associated with, preventing those cardiovascular events to happen.
So let's talk a little bit about what may be happening on the level of the heart. Again, a lot of this science is still unfolding, but you told me something interesting off the air. So we all know what ischemia reperfusion is. We know that when you have a stroke, you end up with lack of oxygen to the brain, and then an inrush of blood with reestablishing oxygen. And that phenomenon of starving cells for oxygen and then giving them an abundance of oxygen injures them, correct?
Yep.
Okay.
Yep.
So to the person who's having oxygen drop and rise 10, 20 times an hour, is it possible that these are like micro ischemia reperfusion events that they are sustaining, and that over the course of years, it turns out to be something that causes damage to the heart muscle?
Yep. That's exactly one of the hypotheses that we have, not only to the heart muscle, but to the arteries and to the brain. So yeah, there are more and more studies looking at the association between untreated sleep apnea and risk for Alzheimer's disease or cognitive decline. So there's also a lot of study on that field as well. So that's really one of the theories that might explain, this exposure in a long term of patients that are untreated with sleep apnea continue to have those cycles of like hypoxia and reperfusion, and then what we usually call it in the field is like cyclic intermittent hypoxia, because it's like a period of hypoxia that lasts maybe 3-4 seconds, sometimes even more. And then the patient wakes up, and then the blood oxygen goes up again, and then it's sustained for a little bit, and then they fall back asleep again, and then another event happens. So this cyclical event of hypoxia might lead to a lot of those alterations that we see that are risk factors for cardiovascular diseases. Another biomarker that has been recently described, and I think you're going to find this interesting because it involves a lot of the physiology behind those events, is that it was a group in Harvard that described that if you have when you have an event, you're going to have a heart rate response to that respiratory event. So, for example, you're going to have an event, and sleep apnea, and then your heart rate is going to increase because of the event or because of the arousal, right, related to that event. Now, the people that have this relationship between the event and the heart rate response to the event, stronger, those people are also at increased risk for cardiovascular disease. So it doesn't have to do anything with how many times you have the events, but how you respond to those events. And that's another biomarker that's currently being investigated in the field as well.
So let's think about the whole body for a second, right? If somebody comes into your bedroom and puts a pillow over your face and you start to struggle because you're smothering. Mm-hmm. I keep thinking of sudden infant death syndrome and the serotonergic response in the brain that makes you turn over and gasp for air. So this is happening 20 times an hour. Like somebody's putting a pillow over your face, you're waking up, you're falling asleep. Do you think you're resting? I mean, it's very sad. I have a cousin who died in his sleep. And when I asked my cousin, about the situation, she said, well, he was diagnosed with atrial fibrillation because he's had obstructive sleep apnea for many, many, many years, but he just couldn't get used to sleeping with the CPAP. And so he died in his sleep, sadly, of heart failure because of obstructive sleep apnea. But I keep going back to snoring. Snoring is a form of somebody covering your mouth and keeping you from breathing freely. When your brain goes, wow, we're having a struggle to get air in and out, you are not sleeping, or you're not sleeping deep. You're not sleeping well. You're not recovering. If anything, you are sleeping in a pool of stress hormones. Think about what that's doing to your telomeres. People are talking about anti-aging. It probably has an effect on senescent cell accumulation. If you're snoring, I know your study was not about snoring, but I'm sorry. I'm a critical thinker. I can't help, about 7 years ago, we did a show with a scientist who published a study that showed that people who are pre-diabetic end up with all the same diseases as people who have frank diabetes, but slower. You know what I mean? Like it's not like, oh, you're safe. You're going to get it too. It's just going to hit you slower. So I got to believe that people who snore violently at night are probably suffering from some of these same problems, but they're just not diagnosed as soon because it takes longer for it to kill them.
Yeah. And sometimes there are a lot of cultural aspects too, depending where you are in the world. Some people think that snoring is healthy. They ate a great meal. It was nice time with the family. I'm going to take a nap. Oh, and no, he's snoring loudly. Oh, he must be good because he enjoyed the time with the family and he enjoyed the food. And sometimes those changes are difficult to kind of understand it and change the way that your understanding of the behavior is, right? So yes, I understand that, you should be able to, be aware of a sleep problem, and snoring is almost like the window to the problem, right? So pay attention to the snoring because it could indicate, it's actually very likely that it's something worse going on with your body.
Len Moskovitz points out that in the wild, and we're talking about ancestral, right? Because I'm a big fan of evolution. Evolution answers all the questions we have today. In the wild, if you snore, you die. It is not a self-preservation act. Snorers didn't make it to longevity in ancient times because animals could find them while they were sleeping and eat them. It's perfect. It's really a great crude but true example. We're going to take a quick commercial break. Please post your questions. We will work them into the show. I promise you. Stay tuned. We'll be right back with more Superhuman Radio. Hey, this is Carl Lenore. Superhuman Radio is the longest running health, fitness, and anti-aging podcast in the world, going into our 16th year of continuous production. If you have a product that you think would appeal to the Superhuman Nation, we can get you on the air quickly and inexpensively to help promote your brand. Join the ranks of some of the largest and most successful companies in the world who know how great it is to be affiliated with Superhuman Radio. Contact Dan Kapitsky today. That's DAN.KOPITZKE at superhumanradio.net to learn more. Knoll Creek Hemp Company's Delta 8 soft chews are the premier Delta 8 product on the market today. Knoll Creek's Delta 8 is produced from high-quality hemp-derived CBD oil, and soft chews are manufactured using proprietary nano-emulsification technique that ensures the Delta 8 soft chew will timely deliver the desired effects cleanly and consistently from piece to piece. In a space where at least 70% of the products fail to meet label claims and where most users of conventional hemp products are left disappointed, Knoll Creek's Delta 8 soft chews are a product you can trust. Visit shrnetwork.biz/Delta8. That's DELTA and the number 8, and use the code SHR20 to get 20% off your first order today. Every day, there's a new wellness trend. Eat that. Do this. Avoid those. How do you know where to start or who to trust? Inside Tracker helps you cut through the noise by analyzing your blood, your DNA, your lifestyle, and your fitness tracker to provide you with a science-backed, trackable action plan on how to live, age, and perform better. Personalized, one-size-fits-one recommendations to help you optimize you. For a limited time, Inside Tracker is offering Superhuman Radio listeners 25% off the entire store. Go to shrnetwork.biz/Inside Tracker, INSIDETRACKER, to save 25% off. Change begins on the inside. Raw milk.
New Mass Pro Synthogen X2 just upped its own legendary game. To distance itself even further from the rest of the pack, Synthogen X2 now has double the key active ingredients. If you've ever wondered what steroid-like recovery feels like, Synthogen X2 delivers. See why others compare it favorably to powerful bodybuilding drugs at synthogen.com. Mass Pro Synthogen. When you train with it, you'll gain with it.
If there is one mineral you should be worried about not getting enough of, it's magnesium. Magnesium is the body's master mineral, powering over 300 critical reactions, including detoxification, fat metabolism, energy, and even digestion is influenced by the presence of magnesium. That's why I'm so excited to tell you about a new magnesium product I've been taking now called Magnesium Breakthrough. It's the ultimate magnesium supplement, easily the best I've ever seen or experienced. With all 7 forms of magnesium, I was able to arrange an amazing deal for my audience, and I guarantee it's the best deal available on this product. Seriously, with volume discounts combined with our custom 10% coupon code SHR10, you can save up to 40% off select packages of Magnesium Breakthrough. And I promise that this deal is only available on this specific website, magbreakthrough.com/SHR. You won't find that deal on Amazon or even on the company's own website. Go to magbreakthrough.com/SHR and use code SHR10 to save up to 40% off select packages of Magnesium Breakthrough. Remember those rectangular toaster pastries you used to love when you were a kid? Well, Legendary Foods has just made them better. The new cake-style tasty pastry is like nothing you've ever had before. With 20 grams of high-quality protein and less than 1 gram of sugar, you'll feel like you're cheating, but you're not. Go to shrnetwork.biz/legendary and use the code SHR10 to save 10% off your purchase of tasty pastries. Now available in cookies and cream, red velvet cake, birthday cake, blueberry, strawberry, brown sugar cinnamon, and hot fudge sundae. Go to shrnetwork.biz/legendary and use code SHR10 today.
This is the Superhuman Channel, where brawn and brains finally meet.
Welcome back. So we've discussed now the study, and there seems to be a correlation between people who wear their CPAPs properly, who have been previously diagnosed with OSA, and not having heart problems. Now, I think that's very promising to me. I don't think you really need much more than that. And as you point out, the studies will never be able to be done because the people in the control group are destined to be hurt, And we can't do those types of, you can't even get an IRB for a study.
Yeah.
Is something like that. So let's talk a little bit about some of the dots you've connected in your career as far as the types of people that have obstructive sleep apnea. So you said gender plays a role. Men tend to get it more often than women.
Yeah.
Okay.
And then one comment about this, actually, that bringing up a topic that you also mentioned about aging, right, and the hormones. So it's like the relation between, or the association between sleep apnea and gender is more relevant at younger ages because women are actually protected from their hormones. When women hit menopause, the prevalence of sleep apnea between men and women are similar. So it's just with the hypothesis that you indicated that their hormones are being protected.
So I want to make a supposition, and again, I'm not a scientist. I've had a big interest in obstructive sleep apnea for at least the last decade. I fit myself with a CPAP. I shared with you off the air.
Mm-hmm.
I use the nose pillow, they call it. It just fits in your nostrils. I want to talk about that a little bit later. But I have this theory about obstructive sleep apnea. And I think it actually emerges from the gut inflammation. So just humor me for a second. I'm going to kind of go down this road. Hormones play a large role in the diversity of the population of microbes in your gut. We know that hormones and microbes tend to work together. Like, for instance, when there's higher levels of oxytocin in the blood, we see more L. reuteri, which is a age protective microbe in the gut. We know that high levels of testosterone shift the ratio of bacteroidetes to firmicutes, as do high levels of estrogen. So the gut, I firmly believe, is the culprit for OSA. I think that when the gut becomes inflamed and we develop gut problems, and inflammation is one of the problems because the immune system resides in the gut, and the inflammatory soldiers, if you will, or the army of the immune system, when the gut becomes inflamed, it goes north too. And so you have people that you can tell their voices change over a period of time in their lives, right? They get older, and all of a sudden their voices get raspy. And when they breathe, you can hear them breathe. And there's this phenomenon that happens, and they could be lean, they could work out every day, but what they almost always have is a distended stomach. It just sticks out, almost like a pregnant woman, but milder, not that far, distended stomach. And so this distension is indicative of gut inflammation, and gut inflammation contributes to the narrowing of the esophagus and the airways. These people have trouble swallowing, by the way. You know who you are if I say this. Oh, you're eating something, and all of a sudden you feel like it's just not going down. You got to grab the water and drink it to push it down. So this is systemic, and breathing is just part of the damage that it's doing. What do you think about this phenomenon? Maybe we're looking at all the wrong things. Maybe we should be looking at people who have known digestive issues and gut issues and seeing what the population of OSA is in that group. Well,
actually, it's an interesting hypothesis, and I am no good microbiome expert, but based on what you propose, what other studies have shown was the other way around, right? So sleep apnea, because of that inflammatory damage that is expected to happen in more severe cases, that could definitely impact your gut microbiome, because depending on your inflammatory markers in your blood, that might change the composition of your microbiome, right? Now, the other way around, I don't believe that this question was ever investigated, right? So, an interesting study that could be designed is start with people that have chronically some of those GI problems that you indicated, and then determine whether they are also at increased risk for sleep apnea, right? That's something that's not necessarily, assessed. And then, so I don't think we had enough time to talk about it in the beginning, but I am actually, I work with medical informatics. And what is medical informatics?
Mm-hmm.
Is how you leverage, the electronic health record, which is like that place where all the data from the patients are available for their clinical care, but to do research. So this type of study could be done preliminarily using, some searches in the electronic health record to see if we just answer this very simple question: can we find a higher prevalence of sleep apnea in those reporting GI issues in the very beginning? So that would be an interesting question to pursue.
So Boyd Starr says, my sleep apnea is always worse after eating inflammatory foods, in my case, gluten and dairy. And I'll tell you something else. I don't like to talk about shows that are coming up, because I've had people on other podcasts actually go and steal the guests from me. But I'm about to do a show. So there's a lot of discussion about whether or not non-nutritive sweeteners are anything other than, wonderful. A lot of people want to say, oh, it makes it spike insulin. All the metabolic stuff hasn't played out. But what was just discovered was there are 3 non-nutritive sweeteners that are very popular in our foods today that shift the prevalence of 2 different forms of oh God, I'm going to forget it. I can't believe I can't. They shift the forms of 2 pathogenic microbes in the gut to increase 2 different forms of E. coli that are harmful. Now, understand this. So if you have an abundance of this particular microbe in your gut, it eats the artificial sweetener. That's why it's growing in population. But what it poops out turns out to be damaging to the entire nervous system. Now, why is that important? Because the tone from the what's the big nerve? I can't think of it now. It's anyway, the tone from the nervous system is what keeps the roof of the mouth open when you're breathing, but you're sleeping. And when innervation is interfered with, the nerves, the tone disappears, the muscles collapse in the back of your throat. So there's emerging information right now about artificial sweeteners and the role that they play in. And I'm not saying it's just artificial sweeteners. We have a fellow right here who's saying when he eats these foods, he knows his sleep apnea gets worse. But I keep coming back to the gut. I keep thinking to myself, when I look at the population of people who snore and have mild to moderate or to severe sleep apnea, what is the cross section? Where do they all connect? For a long time I thought, well, they all drank coffee, and I'm not completely poo-pooing that idea, but they all tend to have some sort of gut problem that they talk about. Oh, I have terrible GERD. My food doesn't digest fast. They almost always have distended stomachs, and they have obstructive sleep apnea.
Yeah, I think, it's a question of like cause and consequence, or like what came first, right? So I think we don't really have enough studies to demonstrate this relationship, but I think like this anecdotal cases, they are important to actually guide more research in some areas. And I think that, one of the benefits of talking about your work is that it can actually bring more ideas to be explored. So yeah, so I appreciate the comment, but I do think that there are more studies that need to be done to understand that phenomenon.
There's another interesting interaction here. We know that there's an opioid epidemic today. Mm-hmm. And I would imagine that people with even mild obstructive sleep apnea would tend to die in their sleep if they're using opioids, because opioids already suppress the portion of the central nervous system that makes you want to breathe. Because when people overdose on opioids, they stop breathing. That's what happens to them. Is there any evidence out there that opioids are contributing to any of the OSA out there?
There are some association studies looking at opioid use and worsening of sleep apnea. But again, like I am not well versed in that literature to know to say for sure. But again, the mechanism explains, and I think there's a lot of depression of the central nervous system, which could also impact how your body responds to some of those events that happen because of sleep apnea. So it's, my hypothesis is that there could be, so there's two major types of sleep apnea events, right? There are the obstructive events, which are the ones that happen because you have a collapse in your airway. And then you know how to differentiate them, because if you have a respiratory pause, your body tries to breathe, tries to bring in more air. Right. And that's when you see like those movements from chest and abdomen, especially when you're looking at the sleep study. But there's another type of sleep apnea event, which are central events.
Central, right. And
it's when the brain is not telling you that you need to breathe. So that's a problem. And I would hypothesize, again, I'm not well versed in the literature, but I would hypothesize that the impact of opioids on sleep apnea would be more related to central events.
That makes sense. I want to address the CPAP for a second. And then when we come back, we're going to take a break. When we come back, we're going to answer all the questions that are loading up here. So I determined that I needed, Elisa kept saying that I was snoring so loud. And I recorded myself one night. And I, in fact, heard myself hold my breath, not for long, for maybe 10 seconds, 12 seconds, but it became worrisome to me. I also noticed that my heart felt different when it beat. I felt like there was extra beats here and there, maybe the atopic, what do they call them, ectopic beats,
Yep.
PVCs or stuff like that. So I went to a website called Second Wind, and they sell refurbished CPAP. And I got my doctor to write me a prescription for it. I paid for it out of my pocket. It's a DeVilbiss. It's nice. I still have it. It's like 10 years old. They work forever. But when I first tried to experiment with it, I put the mask on. The mask made me feel claustrophobic. It made me feel like I had this big apparatus. It was very hard. But more importantly, I tended to breathe through my mouth with the CPAP on. And I found in the morning, my throat would be dry. It would be hoarse. And I thought, this can't be good. Around the same time, I was communicating with a guy named Stephen Scott, who works with carbon dioxide. Carbon dioxide is not a waste gas. It's actually important for the liberation of oxygen from red blood cells. And he and another good friend of mine, Ron Penna, they were talking about taping their mouth. So when you breathe through your nose, what the appropriate way to sleep is to breathe through your nose. When you breathe through your nose, there's a process called turbination that picks up nitric oxide. The nitric oxide is inhaled, and it actually dilates blood vessels and relaxes muscle tissue, and it makes you sleep deeper. But if you're breathing through your mouth, you're bypassing that phenomenon. So I went out and got this little thing that just fits in my nostrils like this. I know everybody's got to get a kick out of me, but my fingers in my nose. And I take my mouth, and I have never slept better. And the pressure I use is considered very small, 6 to 9, 6 millimeters of water to 9 millimeters of water. Most people are sleeping with 12, 17, 20 because they're trying to pressurize their entire face. I sleep so good now. It's not intrusive. I don't feel like I'm wearing a big contraption. I really think that we need to do away with that whole face mask and start getting people to tape their mouth and use the nose apparatus instead. What are your thoughts on that?
Yeah, so I think there's lots of differences in how people respond to the CPAP therapy. And probably one of the things that impacts the most is their preference on the mask type and how the mask works for their face shape. And I think, we are still trying to transition from that one size fits all approach to something a little more personalized, right? So I think studies like the one that we've conducted and, the field is doing about sleep apnea, the consequence of sleep apnea and why therapy is so important. It could be a call for industry and innovation, right? Because that's what I think that if we can understand what are the factors that impact whether someone in need for a therapy to actually be more adherent to the therapy, that's something that might be useful to know. And I think that impacts if that impacts what's the best mask that you need to use, or if it's a nose versus a whole face, And if there's different, like there's the humidifier in the mask or not without a humidifier. So this brings in like another study that we are now in the planning stages, which is how we can make people like adhere or become
more compliant, right? More compliant.
Yeah, but for the long term, right? Yeah. So this study in planning is a study in combination with Kaiser Permanente and also the University of Pennsylvania with Dr. Amy Sawyer. So Dr. Dennis Wan at Kaiser and Dr. Amy Sawyer at University of Pennsylvania School of Nursing, they are the principal investigators of the study. And one of the things that we are trying to do is really understanding if like a nudge could be more helpful to increase people, increase their adherence for CPAP. So the way that we are planning the study in a sense is that, well, what happens if every time that the patient is not using the CPAP at an appropriate level, an automated text messaging with informations about checking your mask, cleaning your mask, make sure that you're using it appropriately. Does that help? And that's going to be a study that we're going to investigate in the long term for 2 years, if like those nudging messages can impact your behavior to actually improve.
So when you say nudge, are you nudging them in their sleep, or are they getting these messages the next day?
In the next day, yeah. No, obviously the next day. I definitely don't want to cause any like sleep deprivation for these patients, obviously, right? So that's one of the studies that we're now planning. And then I think we have enough evidence from past studies that this nudging in the short term and even in the midterm, like 1 year after. So at 3 months, the nudging works. At 1 year, the nudging continues to work. But the problem is that the incentives, you just mentioned that you got your CPAP machine on your own and you were kind of like trying to figure out, how well the pressure works for you and etc. But for most patients, they are still going to rely on insurance for the diagnosis of sleep apnea and for the therapy. Now, the incentive for the insurance is only on the short term. Insurance is only caring about if you're compliant, if you meet a certain criteria in the first 3 months. And then that's it. So we don't really know what are the benefits much beyond that. So at a level that we can, simulate public health changes that will have people use their CPAP for longer. And that new study that we are designing, we hope to answer some of those questions.
We have to take a break, but before we take this break, I have to mention one of our sponsors because I haven't slept this good in I don't know how long. I've got my breathing set now because I have my little nose pillow that I sleep with. I don't snore, but I have been using one of our sponsors is Knoll Creek, and they make this new Delta 8 CBD. And I take one of their gummies at 7:30, and I get in bed at 9 o'clock, and I am tracking some of the deepest, most restful sleep on all of my different tracking devices. So if you're somebody who struggles with falling asleep and staying asleep, Knoll Creek's new Delta 8 CBD is the way to go. We run a commercial for them. Just listen to it. We're going to take a quick commercial break. And when we come back, we have lots of listener questions and comments. Stay tuned. You're watching and listening to Superhuman Radio. Is there something interfering with your happiness or ability to achieve your goals? BetterHelp can help. They will assess your needs and match you with a licensed therapist. This is not a self-help or crisis line. It's professional counseling done securely online. They have a broad range of experts and are available worldwide without having to wait in an uncomfortable waiting room. Get the help you need and start living a happier life today. Go to shrnetwork.biz/betterhelp. That's better, HELP, and receive 10% off your first month of counseling when you use the code SHR. Raw milk. I need to share with you all a revolutionary new wearable technology called HapBee. HapBee allows you to enjoy the effects of caffeine, alcohol, nicotine, melatonin, and muscle relaxants without actually ingesting anything. Yes, really. They figured out the unique magnetic signature of each of these molecules and recorded them. Just put the HapBee on, choose the signal you want, and it starts projecting the magnetic signature of that molecule that you choose, like coffee for feeling alert. Go to hapbee.com/SHR. That's HAPBEE.com/SHR. SHR to learn more and unlock an $80 discount exclusively for the Superhuman Radio listeners. Attention meat lovers. I've discovered a snack with just 2 ingredients, meat and salt. That is so tender and delicious, you almost can't believe it. That's right. No soy, sugar, or other crap. Our partner, Carnivore Snacks, nailed it with these mouth-watering snacks. They have a variety, too. Ribeye, pork loin, leg of lamb, and more, all sourced here in the USA from regenerative farms. Claim your Superhuman offer from Carnivore Snacks today at shrnetwork.biz/snacks. That's SNAX. Use the code Superhuman for 15% off your first order, plus a free 2-ounce pork loin. Whether your goal is to build muscle or burn fat, you'll find everything you need at Redcon One. Need help getting a good night's sleep? Try Fade Out, or the most popular pre-workout supplement on the market today, Total War. Sign up for their new Transformation Challenge and win $10,000, or shop for apparel that people at the gym will know that you are serious about your training. Need a testosterone booster that works? Check out Boomstick. Whatever you need, you'll find the best quality supplements on the market at Redcon One. Go to redcon1.com. That's REDCON, the number 1.com, or go to superhumanradio.net and click the Redcon One banner ad today. Being superhuman means being conscientious about the choices we make. White Oak Pastures is superhuman when it comes to raising livestock. They're committed to animal welfare, land regeneration, and rural revival. They responsibly manage the entire process from the pasture to your doorstep. High-quality, pasture-raised, great-tasting meat from a farm you can trust. Full nose-to-tail selections. They even have options for your pet. Go to shrnetwork.biz/whiteoak and use code SHR20 to save 20% off your entire first order. Hey, this is Carl Lenore. Superhuman Radio is the longest-running health, fitness, and anti-aging podcast in the world, going into our 16th year of continuous production. If you have a product that you think would appeal to the Superhuman Nation, we can get you on the air quickly and inexpensively to help promote your brand. Join the ranks of some of the largest and most successful companies in the world who know how great it is to be affiliated with Superhuman Radio. Contact Dan Kapitsky today. That's Dan.KOPITZKE at superhumanradio.net to learn more.
Spit that out right now. This is the Superhuman Channel.
We'll do our best to get through all these questions quickly. Some of them are comments, some of them are questions. So Danny Geraldo Okendo, who watches the show live from Colombia, said that he says, greetings from Colombia, great topic. I do snore and generate apnea in moderate levels. I have no overweight. I'm not overweight, and I'm 33 years old. So here's a perfect example. Look at his picture. This guy is muscular. He looks like a bodybuilder.
Yep.
And he's not the typical guy that you would think would have obstructive sleep apnea. He's lean. So let's see this one here. Stephen Rushing says, I also notice that on the days I do moderate intensity cardio, my pulse oximeter readings are generally better. I think it primes me somehow. He goes on to say, I got my tonsils removed and turbinate reduction, which improved my sleep apnea test by 30% better, but still am unable to adhere to CPAP due to irritation and diminishing returns. I wonder how he's determining diminishing returns due to losing more sleep, trying to get used to wearing it than without it. And I think this is a really big problem with compliance. Would you agree?
Yes, no, I totally agree. And that comes to that scenario where it's not one size fits all, right? We are trying to, make that point that CPAP, can be very helpful in treating your sleep apnea, but maybe at different, like for some people, especially if you're not really in the moderate severe, sleep apnea range, maybe you should be able to use like other alternative therapies, like an intraoral device. So there's like a mandibular device that can be helpful to just open your jaw enough that will improve the opening of the airway, and that's going to be enough. So it really depends on the scenario, and that's why it's such a complex disease. But there are other therapies that are out there for milder cases that could be just enough, especially for non-adherent patients.
So Patrick Rogers, and by the way, happy birthday, Patrick. He just had a birthday, I think on the 28th it was. So is there any evidence that wearing a CPAP for sleep leads to weakening the diaphragm muscles due to the positive pressure that is assisting the breathing action?
I am not aware of any evidence, but I do like to point out that understanding the appropriate pressure that minimizes your respiratory pauses is important. And usually that's done as part of like a sleep study. There's like several types of sleep studies. One of them used just to diagnose sleep apnea, but there's another one where you actually do a CPAP titration, where you actually find the appropriate pressure that minimizes the events without causing any other physiological damage. So, the goal is if you're worried about this, talk to your doctor and, potentially get another titration study to understand whether your PAP pressure is appropriate.
And there's another aspect to this, Pat. While inhaling is assisted, exhaling is resisted. So if anything, the diaphragm is working harder to push air back out of your lungs.
Yeah, and there are some devices that actually do like a bi-level pressure.
Yeah.
So the inspiratory pressure is stronger, right? It's higher, and the expiratory pressure is minimized to avoid exactly this problem that you're talking about. So depending on the results of your titration study, there are some cases that you're going to be indicated to this like bi-level device, type of device.
I actually tried wearing one of those when mine does that, but I moved it back to just plain CPAP and just keep it on a very, very low level, just enough to stimulate the back of my throat from collapsing. But when I tried to use the BiPAP or whatever they call it, that function, it's supposed to be instinctive. Like when you inhale, when you go to exhale, it's supposed to reduce the pressure. But that transition was causing me to pay attention to it. Like, it totally blew me away. I couldn't use that. I tried it.
Yeah.
Joel Jha wants to know what your view on mild to borderline OSA and the use of a mandibular splint. Forget about heart and diabetes and that stuff for a moment. Do you think the CPAP is still useful if perceived quality of sleep? Also, can you talk about other sleep conditions that have similar effects as OSA, things like disturbed quality of sleep?
Right. So several questions in that question, right? So in thinking about only like mild and borderline sleep apnea, so one of the most important things to begin with is that the way that we diagnose sleep apnea, as I mentioned earlier, is there's a lot of variation on the night-to-night basis of how you calculate that number, the AHI, which classifies you as being diagnosed with sleep apnea or not, or having mild, moderate, severe. But it's specifically worse when you look at this mild borderline OSA, because one night you might have your AHI less than 5, which is considered normal, and another night you might have an AHI of 10, and that is because there's still a lot of error in the way variability that we expect from the measure. And there are several studies now trying to specifically characterize. So then, for example, given a certain value for the apnea hypopnea index, you are 97% certain that you are within this category of severity for the disease. Now, that said, there is evidence that CPAP is useful in perceived sleep quality. Actually, there's maybe 3 major outcomes that studies have demonstrated that CPAP works. And based on those randomized controlled trials, which is like the top of evidence, one of them is quality of life. So those that have sleep apnea and use CPAP, they have improved quality of life, which can be reflected, can be explained by the improvement in quality of sleep. We also see effects on sleepiness. So if you are sleepy with sleep apnea and you use CPAP, your sleepiness improves, and that's one of the strongest effects. And there's 2 more relevant, even though not forgetting completely about heart and diabetes. But we know that CPAP decreases blood pressure. So if you have hypertension and you use CPAP for a long time, your blood pressure is going to decrease, even if you're treated with antihypertensives. And it also regulates your insulin metabolism, so actually prevents insulin resistance. And that's why, with this recipe, right, of how CPAP improves all those little things that relates to cardiovascular risk, why do they not prevent cardiovascular diseases? And that's the reasoning for the study. So, and then about other sleep conditions that have similar effects to sleep apnea, depending on the type of insomnia, you also will have impacted, awakenings and arousals. So you might have like a very common condition is a comorbid sleep apnea and insomnia, which deserves like it's a specific line of therapy, which you incorporate cognitive behavioral therapy with a therapy specific for CPAP, being that, like CPAP or the intraoral devices. So, the concern is that we feel like we know a lot about sleep apnea, but we don't. Like the more and more we study about it, the more and more we characterize how complex it is. And the more and more we need to go into this perspective of moving from the one size fits all to the personalized medicine within that this is.
So I tried one of those intraoral devices, the whatever you want to call bite guard or whatever. They're horrible. They gave me a temporary TMJ problem. When I would wake up in the morning, it was hard for me to even get my bite to work properly. And the other thing is, you breathe through your friggin' mouth when that thing is in. And you got to stop breathing through your mouth. That is part of the problem. Breathing through your mouth is not how you're supposed to breathe when you sleep. You are breathing in gases from your stomach and undigested food, and that's coming up from your gut. You don't want to be breathing through your mouth. If you wake up in the morning and your gums and tongue are dry, we just did a show about this with a dentist, how horrible that is, how it actually changes the microbiome in your mouth to be unhealthy. So you got to sleep with your mouth shut. And I believe that so strongly that I've been taping my mouth for, 6-7 years now before I go to bed. I mean, Elisa and I, we have our conversation, and then I say to her, okay, are we done talking? Oh, yeah, we're done. I kiss her goodnight. I put the tape on. I don't talk anymore for the rest of the night. And it works. It works. I sleep so good. Okay, real quick. Boyd Starr says, food plays a huge role in inflammation, in my opinion. I went on keto diet for 3 months and was almost 100% off my asthma medication. I know a guy who went carnivore and went from having sleep apnea to not even snoring. And this is another anecdote that I say, this is coming from the gut. It's not like he lost weight. He was already a small guy. He's actually been on my show. But he went carnivore and he just stopped snoring. All of his snoring problems just went away, just like that. Len Moskovitz says, drugs like prednisone cause fat deposition. More than fat, they cause water, fluid retention. They cause spontaneous. That's why you literally can put on 10, 15 pounds on a single round of methylprednisone in the gut and the neck. And I wonder if these drugs are causing pressure in the airways that are actually creating apnea issues. Definitely. But it's fluid. It's not fat.
Yeah, it makes sense. Again, I'm not aware of any study that systematically assessed that, but it makes sense according to the physiology.
Okay, Joel Joss says, I find CBD very hit and miss and can do the opposite and keep me awake. It's not reliable with falling asleep. If you give Knoll Creek a try, I'm going to put their banner ad up. I promise you, there's nothing like this. You got to forget about CBD. I've talked to people on the show. I said, I tried CBD and didn't know what all the fuss was about. It didn't do anything for me. But Knoll Creek CBD, theirs is the Delta 8 THC form. Delta 8 THC is the new thing. It's not the illegal form of THC that you find in cannabis. It's a form of THC that you find in hemp. And while it's not psychoactive, you feel it. When I take a gummy, within an hour, I'm like, oh man, I want to just go to sleep. It works. You give that a try, and I promise you, if it doesn't work for you, send it to me. I'll refund your money and I'll use it. Patrick Rogers says, I have sleep apnea because I'm an overgrown person. I have been using CPAP for a couple years now, and it helps tremendously. Interesting. Thanks for getting to my question. And all right, thanks. Okay, there you go. That's the end of it. did we miss anything? Is there anything you want to bring forth that we didn't cover?
I think it sounds pretty good. Again, very happy to be invited to speak here today. I hope that the topics that we discussed were helpful for the audience, were helpful for you. And I do believe that increasing awareness about obstructive sleep apnea is important. We need to know our sleep, and not only sleep apnea, but I think sleep as a whole. I think there's several issues in the sleep research community that are now being transcended to the general audience. And I'm happy to see that people are becoming more aware of how they sleep and the importance of sleep. In the past, we used to think that sleep is not important. We just sleep for 4 hours, we were fine. But we know how much a good healthy sleep habits can dramatically improve your performance, your cognition, the way that you deal with life. So it definitely affects all facets of life. So
and I don't and I want people to heed this warning. If you snore, get busy now figuring out how to stop it, because it's not good. I don't care if you don't have obstructive sleep apnea. I have a good friend that I love, and he snores so bad his wife was getting aggravated about it. And I said to him, try sleeping with the CPAP that I use, the nose pillow, and it's very simple. And he said, yeah, but I'm not tired during the day. I can't tell you strong enough that if you snore and ignore it, it's like having a mole on your arm that keeps growing and getting bigger and changing colors and going, oh, it's not cancer. I'll just leave it alone. I'll leave it alone until it consumes the entire arm, and then I have to have the arm amputated. If you snore, start thinking of yourself as a potential obstructive sleep apnea patient in the near future and address it now. I really feel strongly about that. I don't think we're supposed to snore. I don't think children are supposed to snore.
At least get a test and talk to your physician. Get a sleep test. There are screening tools. We are seeing a lot of advancement in the wearables field about how using information from your wearables might actually be useful to screen for sleep apnea beyond just the symptoms of snoring. So I think that it's good to be aware of how we can improve your sleep, and if that means treating your sleep disorder, that's what you should do.
Len Moskovitz says, I feel Diego's compassion. Great guy. Thank you.
Thank you. It's a pleasure.
Thank you for being here, Dr. Mazzotti. And I hope everybody takes this show seriously. And if you snore, do something about it now. We'll see everybody tomorrow with more Superhuman Radio. Please share this show, because this is one of those shows that could save a life. Really can. Take care.
All right. Thank you.